Good morning, everybody. It's Nada again. I'm starting another segment today. This is my second day doing the nursing. Nada knows nursing matters. Today I'm going to discuss attitude in the workplace. Um, Attitude in the workplace, to me personally, is very important. One of the reasons is because you're already dealing with debilitated patients or patients that are already sick. And when you combine your negative energy or your negative attitude when you come to work towards these patients, it just makes them feel worse. And that's not fair to your patients. So I'm going to be discussing with you your approach. Sometimes some things that you can do prior to coming to work to enhance your work environment in a positive manner. One of the things that I like to do is music therapy for myself. I believe in music therapy for myself as well as my patients. If I'm dealing with some personal issues and I know the devil is just on me all week, a few weeks, a few months, in that storm, I go into prayer. Prayer does change things. I know we are reluctant. Some of us are reluctant to talk about God and prayers on the job, off the job. I'm one of these nurses that I play my gospel on my job all the time. I have had issues with nurses or administrative staff. Turn your music down. Maybe once I've had somebody to tell me turn it off. I turn it on low because see what and this is what I feel like on this segment. I'm not saying that everything that I say is golden. Everything that I say is that's the word and that's what it is. It's not. These are actually opinions that I have about my field, the field that I work in. So like I said, some things that you can do as an employee is on your way to work, listen to you some classical music if it's not gospel. Classical music has been proven to decrease stressors, which we know as far as nursing goes, we all have them. Hey, Jamie. Thank you. Hey, Sonia. Yes, it does, honey. Prayer does change things. So like I said, some things that you can do is classical music, listen to you some inspirational gospel on your way to work. So whatever problem that does exist in your personal life, you know that saying, whenever you get to the door, drop all your issues. That's unrealistic. Sometimes we cannot do that. So like I said, that's one of the things that you can do. Another thing you can do is meditate on your way to work. When you think positive, you feel positive. That's the big thing about surrounding yourself around positive people, places, and environment. When you feel positive, it's displayed not only towards your patients, but your coworkers as well. Always smile. A smile is universal. I mean, when I supervise CNAs or I've been in management, the light that I've brung with me to my job, I know helped other people in so many ways, mainly because they've expressed that to me. You know, after they got off from work, now I couldn't make it through this day without you. Thank you so much. You don't know how you helped me. You never know what your coworkers are going through. So with that being said, watch your approach on a job with your coworkers, because like I said, you don't know what they're going through personal. Everybody is not going to tell you, you know, I've been living without lights for a week, or I've been going through with my husband or my boyfriend, or, you know, people are reluctant to tell you things because, you know, as well as I do on a job, gossip is just, you know, the bad travels quicker than the good. And a lot of people are reluctant to tell their business is what they, you know, to regular coworkers. But like I said, a smile is universal. So if you come on your job and you have that, even if you're going through and you're smiling, your patients don't know the difference. Once you are at work and negativity approaches you, how you deal with the negativity can easily determine your future with that company. For example, We all in nursing. We all been, we didn't, whether you've been a CNA or a nurse or whatever, we've all got on a job. And when we first come on shift, the first thing that is normally the argument is a CNA assignment. Okay, this is my thing with a CNA assignment. If you have one more patient than your peers, what is the problem with that? To me, it's not a problem. Maybe you feel like your acuity, which means, your patient load is heavier, not just due to that one patient because of the behaviors of your patients that you have. Ask that person, talk like adults and try and switch that assignment yourself. Because what I will tell you about a nurse, if a CNA can do their own assignments, we prefer that. We prefer just staying out of it, allowing you to gain your own, that's something for you all to do. A supervisor nurse is supposed to do it, but we all know what kind of problems that causes sometimes. But if you can do it yourself. As a nurse, it's aggravating when a CNA comes to work and tells me what they're not going to do because you got one more patient, or just somebody with an attitude like that. Well, I ain't doing Mr. So-and-so today because I ain't doing this. First and foremost, if you coming to work telling me what you're not going to do, I don't know about other nurses, but I'm the type of nurse just to say, well, go home because I don't need you. Especially being that I was a CNA before. I'll split up the assignment with myself and pass my pills because it doesn't matter. What I'm not going to deal with is the attitude and you telling me what you're not going to do. That's common in nursing. I always attempt to solve problems. Sometimes it does not go that way because sometimes you have CNAs, sometimes you have nurses that feel like they're privileged. I've had even nurses say, I didn't go to school to wipe nobody's butt. Well, I just want to let you those type of nurses know you went to school to become a nurse. In nursing school, one of the first classes that we are enrolled in is fundamentals. Basically, that's CNA nursing. So you learn how to perform direct patient care, but you're saying once you get on a job, you're not going to do it because it's not out of your scope, honey. I don't care what your job description says. If it says anything regarding taking care of patients, that's broad. And you might have to wipe a few butts. It's nothing wrong with getting your hands dirty. We as nurses cannot feel like we're better than. I have been privileged to work around some beautiful CNAs that work their butts off. I've been privy to work around housekeeping staff that works their butt off, because we have to understand that nursing is just not nurses and CNAs. Yes, a nursing home is a nursing home, and it wouldn't be considered a nursing home without nurses in it. But your whole team is important. If you don't think that your whole team is important, then you're in the wrong field. If you don't come to... I apologize. My little stand flipped this phone. But if you don't come to work with the knowing that you have to function in a team, then that might not be the job for you. It's a team. I've had housekeepers that have came on the units that I've worked and said, oh, the trash is already emptied. Yes, ma'am, I've already emptied the trash because I finished my med pass, I done cleaned up my area, and the trash just happened to be there. That doesn't make me less of a nurse because I assisted you with your job. It actually shows character. So that's another thing that I want to just put forth. Whenever you're the type of nurse that is able to step out of your comfort zone and do something totally opposite of nursing. I mean, if you a nurse, you already know. We furniture movers, we cable men, we're everything under that umbrella because you have to be sometimes. No, I don't know how to install cable, but I done had to hook TVs up before. I done had to move furniture, moving patients out of rooms. I done had to do a lot of stuff. And I never complained because I never felt like that was under what I'm supposed to be doing. You always want to lend a helping hand when you can, because like I said, people remember that. What else? Another thing I want to discuss is we as nurses and CNAs, we need to stop coming to work concentrating on statuses. This is mainly found in like the nursing community, not just the CNA, but not mainly the CNA community, but the nursing community. For example, I'm an RN, so I don't do this. Or I'm an LPN, so I don't do this. Or when your CNA is coming to you for assistance with a unruly patient or a patient with behaviors, they're trying to put them in a shower room. Or why would you allow her day to be terrible and not provide your assistance? I mean, why would you? I mean, what kind of person would you be? Because you have to think about it. You know, sickness lately has not been discriminating against no one. What I mean by that is young and old. We 5 seconds from being where our patients are. And see, that's what a lot of us don't understand. It always takes something traumatic in our lives to have us focus on that aspect of it. But when you've been good all along to the people that you're taking care of, you know, that doesn't bother you as much. But I often put myself in my patient's shoes, because that's what good nurses do. You know, they can't leave these nursing homes. Quite often, they can't leave these hospitals like we do. We're in and out. We have our lives that are continuing. Theirs is at a halt, you know. So just be respectful of the person. You know, we need to stop looking at our patients as just patients. Because see, when you look at them as just patients, you put them in a certain category. When that could be your mom, your father, just like I said, it could be any one of your family members. Would you want somebody to treat you as like that, like you're treating that type of patient? Sometimes we as nurses have to check ourselves at the door, you know? And my whole thing is, so stop going to work concentrating on statuses. I don't do this, I don't do that because I hold this licensure. Honey, you a nurse, you do everything. If you're a good nurse, you do everything, you know. I like that, Cody. Yeah, we did lose holistic nursing. But some of us still practice, like myself. You have to, you still have to know that nursing is just not about passing pills and doing blood sugars. It's not about that. You have to attend to their psychosocial. You don't know what people are going through. We have a wide range of psych drugs that these people are on. We have a big psych community. You know, a lot of nurses will say, you know, I don't like psych nurses, but when you walk up in most of these nursing homes, what you think you're dealing with? You're dealing with psychiatric patients. So in order to get them in order, to make your job less hard, you communicate with that psychiatrist. You communicate with them. They have what's called GDR, gradual dose reductions. If you are being led under the right DON, they're holding those psychiatric meetings and seeing, you know, what can this patient benefit from? Do we need to increase his Depakote, his Keppra? Do we need to decrease this, or are they too sedative? You have to have people in place in your facility that pays attention to detail. You understand what I'm saying? That's something simple, you know? At the end of the day, as a nurse, you're responsible for your patients and you're responsible for supervising the CNAs on your shift. Remember, when we know better, we do better. Or at least that's how it's supposed to be. What I will let you know is me doing these lives, or I'm really just doing, this is just new to me. I'm doing it to enhance, I feel like, the minds of certain nurses. We have a lot of new nurses coming out of school that really don't have a clue. And we as the older nurses, we should be able to take these nurses under our wings, whether we're LPNs, RNs. I've trained many RNs. I've trained many LPNs. But we should, as nurses, not look down on them because they're new to the field, but help them progress in this field. There's a lot of hate in this field as far as nursing goes. But if we have each other's back, the quality of care of your patients will go up, especially in these facilities, you know. So like I said, that's the end of this live, and I hope you enjoyed it. Have a good day. And remember, when we know better, we do better.